There are a number of key remaining challenges associated with manufacturing CAR T-cell therapies. One of them is how we think about potency. We have measurements of potency. We measure that ex vivo. What happens in vivo, we can track it, but we're still beginning to understand the correlation between what we measure ex vivo compared to what happens in vivo. And we're making great progress in characterizing CAR T cells in multiple dimensions, phenotypically and at the molecular level. I think that's going to inform the process improvement as we look towards expanding into solid tumors. I think another challenge is scaling. I just mentioned solid tumors. We have approvals in blood cancers, and those are the low thousands of patients, depending which country you have approval in. But when we get to the solid cancer, that's many, many tens of thousands. So I do think we need to make improvements in automation and shortening culture. We have a Penn Medicine poster on a 3-day manufacturing process at the meeting. But when we think about access to more people and more countries, we do have to make significant improvements in automation. Also, we're thinking about combinations and how do CAR T cells fit into the whole repertoire of treatment that patients receive. Maybe checkpoint antibodies, maybe oncolytic viruses, maybe some other types of vaccine. So it's a very exciting time. We're having multiple approvals per year now, and I think that's going to continue and ramp up in the next few years.